Here is the Chapter 16 Special Senses lecture. The 5 senses that we have, obviously, are sight, touch, smell, taste, and sensation. So when we talk about the special senses, we will talk about starting with the eye. Anatomy and physiology review of the eye. The sclera is the outermost layer of eye. It's also known as the white of the eye. The conjunctiva is the membrane that lines the eyelid. So if I were to pull the tissue down right here underneath of the eye, the lining inside of there is the conjunctiva. The retina is the innermost layer of the eye. It is composed of nerve endings that are responsible for the reception and transmission of light impulses. The cornea is the part of the sclera that allows light to enter the interior of the eye. And the iris is the colored part of the eye with a contractile membrane. The pupil is the black round spot which constricts and dilates. So during an exam, a physician or examiner will take a pen light and shine the pen light in front of the patient's eye. And what they are looking for is they're looking for the pupil to constrict, because if we shine bright light, then the pupil has to accommodate for that. It will constrict to lessen the amount of bright light that can enter the interior of the eye. Then once they take the light away, the pupil will dilate. And that's part of the examination that they do to examine the eyes, and they will say the pupils are equal, round, reactive to light and accommodation. The lacrimal glands then are the little tiny gland that's at the corner inner canthus of the eye, which is responsible for producing tears that bathe and lubricate the eyes. If your lacrimal glands are not producing enough tears, you can actually go blind from not having enough lubrication. The ear is obviously responsible for our hearing, and when we look at the ear, there are 3 major sections. The external ear, which is this portion here, is also known as the auricle or the pinna. The middle ear is this section here, and that is the tympanic membrane, which is drawn over the end of the ear canal. And then the inner ear, the labyrinth, here are the bones of the ear, the malleus, the incus, and the stapes. One of the things that the ear produces is a waxy secretion called cerumen. Cerumen is a protective mechanism for our ears, so that if anything goes into the ear canal, it is supposed to be trapped by the sticky, waxy secretion and does not continue to travel further down into the ear canal, causing damage. The tympanic membrane is the eardrum, and I showed you the picture of that, is the flat membranous structure drawn over the end of the ear canal. And so just like a drum that someone uses percussive sticks to drum on, our tympanic membrane, if we go back to this picture, our auricle will gather the sound waves, they travel in, and then they bounce off of the tympanic membrane. The eustachian tube then connects the middle ear to the pharynx, and its purpose is to equalize pressure on the outer and the inner surfaces of the eardrum. So when you travel and you go up in an airplane, the sudden change in altitude is more than what the eustachian tube can accommodate, and so then you will start to feel pressure in your ears and need to feel the sensation that you need to yawn, chew gum, or something of that nature to pop to release the tension, so that you don't have that built up in the eustachian tube. Pathology that we see of the special senses. When we talk about the eyes, the most common problem that we see are errors of refraction. Errors of refraction are when your vision changes from 20/20. And so one of the problems that a patient could have is myopia. And myopia is when the eyeball is too long, causing nearsightedness. Now, if a patient is nearsighted, then that means that they have trouble seeing far away. So it's just the opposite of the way it sounds. So the opposite of myopia then is hyperopia or hypermetropia. And that's when the eyeball is too short, and that causes farsightedness. Farsightedness then in a patient is someone who cannot see or has difficulty reading print up close. Astigmatism is another form of deviation that we see in the eyes, and that is just caused by the cornea or lens having a defective curvature. So if a patient has hyperopia, myopia, or astigmatism, and it's affecting their eyes enough that they do not have 20/20 or 20/30 vision, they are going to need the use of corrective lenses, whether it be eyeglasses or contact lenses. Cataracts are opacities that form on the lens or the capsule containing the lens of the eye. Usually we see this with the elderly, but there are some patients who develop cataracts earlier in life, and it's caused by a protein that builds up slowly on the lens. So these patients will start to have changes in their vision. Treatment is to surgically remove the cataract, and so I have a slide that shows normal daytime vision for a patient, and then the simulation of what a patient with cataract vision looks like. So you see during the day they have more like a fuzzy vision, but the problem where patients with cataracts have the most difficulty is at night. And so if you look, here's normal nighttime vision. And these two little lights over here, if you look at this, what it looks like for a patient with cataracts, they get like a halo shape around those lights, and they become very bright. And so these patients have difficulty driving at night because of the halo effect of lights in the oncoming traffic. So that can become a little bit dangerous for them. Glaucoma then is increased pressure within the eyeball caused by a failure of the aqueous humor to drain the eye. This can be a problem if left untreated, can cause a patient to go blind. It is increased pressure on the optic nerve, which can destroy it and cause that permanent loss of vision. Treatment for this is to have the patient put drops in their eyes, and that helps to reduce the pressure within the eyeball. And sometimes they can do surgery for this as well if it becomes real severe. Strabismus is a term that's used to describe when the eyes turn from their normal position and deviate in different directions. So exotropia, exo means outward or outside, and so that's when one or both eyes turn outward. Esotropia then is when one or both eyes turn toward each other. And amblyopia is called lazy eye syndrome, which is most common in children. If the amblyopia is not caught at a young age and the lazy eye continues, the patient can actually go blind in that eye. So that needs to be treated in its earliest stages. Macular degeneration is a problem that we see that's usually age-related, but can be from toxic effects of some drugs. But it is deterioration of the macular retina causing central visual loss. It is the leading cause of visual loss in the United States. So when these patients look straight out, they have a black spot in the central portion of their vision. So they see peripheral okay, but there's a black spot, and as the disease gets worse, the black spot continues to grow. Treatment for this, sometimes they can do laser surgery. Depending on if it's wet or dry macular degeneration, there are treatments that they can do injections directly into the eye to reduce the amount of fluid that is built up. Otitis media is a fancy term for an ear infection. So it's inflammation of the middle ear, found most commonly in infants and young children, and the reason for this being, for children, the eustachian tube lies horizontally, and when as a person grows, then the slope of the eustachian tube becomes more at an angle. So if you think of a tube with fluid that collects in it, and that fluid lays in there, if there is bacteria in the fluid, then an infection occurs. So that's why kids have ear infections more often than adults. But basically, they develop a very, very painful earache. They may have otopyorrhea. Rhea means discharge or flow, oto, ear, and pyo, pus. And they may experience tympanorexis. If you remember, rexus means rupture, and tympano is a tympanic membrane. So many times what happens is a parent would lay a child down for bed and they'll be complaining of an earache, and they get up in the morning and then they say their ear feels better, and they may see that there's some discharge on their pillowcase. That would be tympanorexis, where the tympanic membrane ruptured because of excessive pressure, and then the drainage on the pillow is the pus that has released from the back side of the inner ear. So treatment for this is bed rest, analgesics to help with the pain, antibiotics. It may require a tympanotomy, which would be to make an incision into the tympanic membrane to release the pressure and promote the drainage. Recurrence of otitis media in children can cause scarring of the tympanic membrane. If the scarring is repeated, then the patient can have a hearing loss due to the scarring. So what the typical treatment is, if a patient or a child has more than 3 to 4 ear infections per year, they're referred to what's called an ENT, which is an ear, nose, and throat doctor. At that point, the child may need to have PE, which stands for pressure equalizing, tubes placed in to drain the fluid. And so that promotes the fluid from the inner ear to drain to the outer ear without building up and causing that infection. Here's a picture of what a normal tympanic membrane should look like when a physician takes an otoscope and looks into the ear. Here is a otitis media, or a ear infection, and you can see down here at the bottom there's a big collection of pus, and you see how the drum is kind of pushed out so that there's fluid behind it. And then here is a picture of what's called otitis externa, and that's when there's inflammation and infection in the outer ear canal. Otosclerosis, then, is a condition that is an abnormal hardening of the spongy bone around the oval window. For this, it causes hearing loss and a ringing sound in their ears called tinnitus or tinnitus. Turn in your book to page 556 for the diseases and conditions that you need to know. The first one is achromatopsia, and that is severe congenital deficiency in color perception, also called complete color blindness. Conjunctivitis, then, is inflammation of the conjunctiva with vascular congestion. It can be allergic, viral, bacterial, or fungal, and the bacterial conjunctivitis is the one we worry about the most because it's highly contagious. So if a child is diagnosed with conjunctivitis or pink eyes, what really the laymen call it, they call the parents and they want them removed from the school immediately so that they don't pass that on to other children. The term nyctalopia. Nycto means night, and so opia is vision, and so nyctalopia means impaired vision in dim light, also called night blindness. Nystagmus is a type of involuntary eye movement where the eye appears jerky, and it may be indicative of a more serious condition that limits vision. Photophobia. You can't break this term down into its literal meaning because phobia means fear and photo is light. So you're not afraid of the light, but you have an unusual intolerance or sensitivity to the light. So patients that have migraine headaches typically do not want to have bright lights. They want to be in a room with no light because the light causes an intensification of the pain that they experience. The term anacusis means complete deafness, or also is called anacusia. Otitis externa we talked about is infection of the external auditory canal, and that was this picture here, otitis externa. This is otitis media. Tinnitus, we talked about, is ringing in the ears, and vertigo is the sensation of spinning motion, either of oneself or of their surroundings. Medical, surgical, and diagnostic procedures. We talked about pressure equalizing tube placement, and they show a picture on page 560, which is insertion of a tube through the tympanic membrane, which promotes drainage from the middle ear to the outer ear canal, and that's what they do to treat children that have recurrent ear infections. Radial keratotomy is incision of the cornea for treatment of nearsightedness and astigmatism. They also call this radial keratotomy. Can't think of it. Okay, the next term is tympanoplasty. LASIK, there it comes to me. LASIK surgery is the same as radial keratotomy. Sorry about that. And then the term tympanoplasty is reconstruction of the eardrum after a patient has had a perforation, or the tympanorhexis, which we talked about. And then the last term, audiometry. Audiometry is measurement of the hearing acuity to various sound waves. Abbreviations that you need to know. Looks like the page number is wrong here. It's actually on page 566. You need to know IOP, which is intraocular pressure, ENT, which is ear, nose, and throat, OM, which stands for otitis media, PE, which stands for pressure equalizing tube, and URI, which stands for upper respiratory infection. You, once again, are responsible for memorizing the word elements and their meanings from pages 547 through 550. And those pages are correct. And here ends your very last lecture for Chapter 16, Special Senses.